Florence, Comite, here at the 21st Conference for Age Management Medicine in Las Vegas, Nevada. We're delighted to be talking about precision medicine and the role in the future of medicine, and actually how we're implementing all the tools that are necessary to encourage healthy longevity and perhaps a health span that matches our lengthy lifespan. I'm delighted to introduce Dr. Jeanette Mccarthy, who's an adjunct associate professor at the Center for Applied Genomics and Precision Medicine at Duke University, with a position as well at the University of California in San Francisco in the Division of Medical Genetics. Jeanette is here today to talk to us about precision medicine, and in particular Genetics 101 or Genomics 101, and how we can actually implement genetics in our practice today. So welcome.
Thank you.
It's been a pleasure having you here at the 21st Conference for Age Management Medicine. And we really enjoyed your lecture on Genetics 101, introducing us to the whole field of precision medicine. I guess the big overriding question is it ready for prime time? And I'd love your thoughts on where you see the future going in genomics.
So it's always a pleasure to come to this conference. And to answer your question, is genomics ready for prime time? It is prime time. It is in prime time medicine right now, not ubiquitously, but you're seeing increasing applications of genomics in precision medicine for looking at predisposition to some diseases, in particular some of the more genetic diseases in the context of family planning, and also in diagnosing some genetic diseases, especially those in children.
Excellent. Could you give us some examples in adult population where predisposition would really help avert or stop disease that might otherwise lead to a chronic disease or really interfere with life expectancy?
So some of the more common uses of predisposition testing now are in the areas of cancer, breast cancer, colon cancer, and other cancer syndromes. There are areas of cardiovascular medicine where it's being used for things like long QT syndrome, cardiomyopathies, and for some other diseases, there are good genetic tests out there now that more than family history even give you a better prediction of who's going to get disease. And these are being used in some cases to initiate a prophylactic therapy or increase surveillance. And in some cases, they really help with family planning as well. If you know you have a genetic predisposition, you can hopefully not pass it on by doing some family planning then.
It's quite exciting in the field of precision medicine because you can literally bring it to life or stop the condition from continuing in a family tree by having that knowledge, that foreknowledge of what to do about it and stop diseases that have devastated families.
That's right.
It's great. We've seen that in our own center as well when it comes to conditions like BRCA or Lewy body Parkinson's, and any number of those conditions, but even more subtle diseases. Now, some of the conditions of chronic diseases of aging, like diabetes and other forms of heart disease, those are a little tougher, right? We're just beginning to crack those codes.
Yeah, the common diseases, the ones that most people have and the ones that we want to know the most about in terms of genetics are tough nuts to crack because they're not purely genetic. They're due to a combination of genes and environment. But having said that, there are certain subtypes of these common diseases like hereditary breast cancer or certain types of hereditary cardiovascular diseases where there are good tests available now. These generally account for only a small portion of the population, but they're interesting and useful nonetheless. When you look at the more common garden variety forms that are due to genes and environment, we do know something about the genetics. We know that there are a lot of genes out there contributing to these diseases, but that environment plays a big role, and that your genes are not destiny.
So it would probably behoove us all as physicians interested in this field and the medicine of the future, which I like to think of as practicing today, to look at all the variables such as lifestyle, environment, sleep, metabolism, hormones, microbiome, which I know is still a little bit a ways in the distance, but so intriguing. In fact, it's amazing that we are actually 10% human and 90% other genomic material.
That's right.
When you look at our organelles.
That's right. So it is important to look at environment as well. And the more you can introduce some genetic testing in there, it's just another tool in your toolbox, but environment and lifestyle is really key as well.
Absolutely. So weaving genomics in and the knowledge we might have about our blueprint, but with the understanding that genomics is not necessarily, genes are not necessarily your destiny, and then there may be actions we could take and use to our benefit to turn off future predisposition, and certainly for family planning is a promise we can all see come to fruition today.
Absolutely.
Good. Well, it's been wonderful talking to you,
Thank
Jeanette.
you.
We look forward to having you back at AMG and teaching the future generation to put this into future programming here as well.
Great. Thanks for
Thank
having
you.
me.